Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Welcome to Accelerated Health with Sara Banta. I'm a wife, mom of 3, and an NANP certified supplement professional, but that's not all. I'm also the founder of the awarded Most Innovative Health Supplement Company 4 years in a row, Accelerated Health Products, a brand offering innovative natural scalar enhanced supplements to optimize your health. And this podcast, it's not just a source of information. We are a community. We're all here to learn and grow on our health journeys, regardless of where you are today. And this podcast is the springboard to learning. The free group coaching on Telegram is where we continue learning together. You can ask your questions. I post tips and tools to deepen your health and to keep you moving forward. So here's what you can expect. New episodes every Monday and Wednesday with in-depth health discussions and expert guests. Hot topics that are in the news every Friday to keep things fun and current. And of course, the free health group coaching on Telegram. The details are on my website, SaraBantaHealth.com. You can ask your questions, and it is an amazing group that is like-minded with you. So have you thought about detoxing, but you're a little worried about those detox flu symptoms? You don't want to be put on a juice cleanse? Well, I've put together over 10 unique easy detox cleanse programs to help you reset your body while feeling great with no detox symptoms. You can take the detox quiz on the site to find out which one is right for you, but maybe you're not ready for a detox. Maybe you just want to start with 1, 2, 3 supplements. Don't know which ones to start with? Complete my health goals form for your free supplement protocol, and I will personally put together a protocol for you. Just by taking a few steps forward, you will change your life. And the difference is I am there for you every step of the way. Today, we are talking about recommended supplements to speed up post-surgery recovery. Hopefully, none of you have to have surgery. But as we age, the bones get a little weaker. We start doing things that are a little more risky, and you just might have to have that surgery. And I always say, there's a place for Western medicine. They fix those broken bones. But then what about the aftermath? Whether it's elective or emergency, minor or major, surgery is never just a physical event. It may involve just a small incision or a complex reconstruction, but no matter how advanced, the physiological, biochemical, and energetic impact on the body is deep and far-reaching. Surgery initiates this cascade of biological responses, some immediate and obvious, others subtle and long-term, where you can't even connect the dots. Wait a second, do I have this bloat because of the surgery I had over a year ago? Or why is my neck hurting from my knee surgery 6 months ago? Or why is my hair falling out? Or why all of a sudden am I gaining a ton of weight? I didn't change anything after my surgery. Your body has gone through a huge stressor, very traumatic. And yes, you might feel like the doctor's in control, they know what they're doing, the surgery went well, but the body is feeling something different. So there's a full spectrum of healing with the body once it's over. And that's why I love to bring on these practitioners that do quantum healing, laser, red light, sauna, rebounding, all of these different modalities outside of supplements and sleep and diet. Those things are first and foremost, right? But there's so many other tools nowadays that you can use to speed up your recovery. And I've had family members just in the last year have knee surgery and then a second knee surgery. And friends say that they've had surgeries and now they've got colitis or they've got Crohn's disease or they've gained 20 pounds. And then when you gain that weight, what is it doing to the other pressures on your body? And what's going on with your brain? There's so many things that are connected that could be affected. So let's go through what your body truly experiences. And as we're going through this, I have to say, I had to go to the dentist and I had to get x-rays. I did not want x-rays. I haven't had x-rays in a long time. And then I had to have local anesthesia. So even though it was local, I'm going to talk you through what I did prior, during, and post that procedure. Minor compared to what we're talking about here when you go under for back surgery or knee surgery or C-section, right? There's all of these little things, or even going under for any dental work or plastic surgery. You know, there's so many things that you could be experiencing for your body's improvement, but you go through this temporary state where your body is in a weakened state because of the medications, the trauma, and all of the stress. So number one, every surgical procedure involves tissue disruption, cutting through the skin, the fascia, the muscles, the nerves, the blood vessels. So this cauterization, which burns tissue to stop bleeding, it also generates oxidative damage. Oxidative damage, inflammation are the number one cause to accelerate aging. So we want to stop that. That is the goal. Then you've got the physical manipulation or repositioning of organs and joints. I mean, even just with like a C-section, organs are moved to the side to get the baby out. Or maybe you have had fibroids removed. They're moving things around. And everything is kind of in this nice little package, happy in there, and then it's being manipulated by human hands. That's not normal. Your body will respond as that is a stressor. So even these events will trigger wound healing response, which is good. It's acute, right? That includes inflammation, which you want. Inflammation is good in short term. Clotting, immune activation, collagen production. But that surgery also creates a flood of those free radicals, reactive oxygen species, which people call ROS, that can overwhelm the body's antioxidant systems. And if left unchecked, this oxidative stress slows healing, contributes to that post-operative pain, and even damages the mitochondria, the engines of the cellular energy. So with all of these, this oxidative stress and inflammation, imagine what happens when you continue on that processed food diet that is full of inflammation. And the tissues then are like, wait a second, I can't do anymore. And the liver is so backed up from just your diet and lifestyle. And then you throw on it this surgery and it says, I give up. I can't do it. I can't do it. I cannot manage inflammation. I cannot manage the medication that you are having to take on top of the processed foods, the artificial sweeteners, the microplastics, the radiation from your cell phone, the halogens, the bromide, the chlorine, the fluoride in the water, all of these things. You know, when I was getting my dental work done, the dentist said, I've never seen gum tissue react and reduce the inflammation so quickly and how healthy your gum tissue is. And I said, well, I don't know what that means. And he goes, that means you don't have leaky gut and that you take care of yourself, Sarah. And I said, oh, okay. So it was a positive. All of the things that I do was helping my body deal with the trauma or deal with anything much more optimally than someone that comes in that has insulin resistance, a fatty liver, and just overall inflammation throughout the body and that liver that can't process things. So then you've got number two, anesthesia and pharmaceuticals, right? These medications are used during and after surgery, and of course you need them. Painkillers, antibiotics, steroids, contrast dyes, they're tools in that acute setting. You don't want to be cut open without a painkiller or without the anesthesia. That will cause major trauma, right? Mental trauma to have that pain and deal with it. But these substances accumulate in the liver and the fat cells. So the more fat you have, and then the more toxins will be stored in the body. And if the liver is not clean, and if it's not processing toxins well before you go into surgery, this is only going to back it up more and really put pressure on your liver. You gotta love your liver, you guys. Your liver is everything. It is the quarterback. And these substances can also disrupt the methylation and detoxification pathway. So not just your liver, but your kidneys as well. Interfere with hormonal balance. Your hormones are managed by the liver, and neurotransmitter activity. Your neurotransmitters and your happy hormones are in your gut. These medications, anesthesia, they cause leaky gut. But so does processed foods. One meal of processed food causes leaky gut. So let's get that out of the way so that our gut can maybe be a little more resilient when it has to deal with these medications. These medications can linger in the tissues for weeks and even months if you're not getting them out, if you're not detoxing effectively to get them out quickly. And then the more they stay in your body, the more damage they're going to do. And the more your body is like, okay, I guess this is part of me. I got to deal with it, and it's going to cause me to run suboptimally. So in particular, the general anesthesia often creates a heavy fog that many people describe as lingering fatigue, mental dullness, or emotional disconnection. And you can get that from the antibiotics as well. My mom is someone that's always been happy, never had any depression or anything. She had to do a round of antibiotics, and afterwards she goes, Sarah, I just don't understand. I feel depressed. Is this what depression feels like? And it was just from one round of antibiotics. So without the targeted detoxification, the body struggles to clear these compounds, and that leads to not just the acute inflammation, but long-term. And that's not what we want. Then the digestive issues, whether it's IBS or constipation or bloat or acid reflux. And then it also will suppress your immune system. Your immune system is not going to be on fire like it's supposed to be, right? Then you've got the inflammation. That's a double-edged sword. It's essential for healing wounds, clearing the debris, signaling to your brain, okay, this is the spot we need to go to and deal with right now, right? Where the cut is open, we need to go clean it out and repair it. And that is recruiting the repair cells. But if the inflammatory response is excessive, unregulated, unresolved, it can be destructive. And nowadays, after the pandemic, most people are suffering from a higher histamine response. And that is causing your inflammation markers to go into overdrive. So you might think to yourself, that's really weird. I never had allergies before. Or that food never triggered a sinus, me feeling stuffed up. And now all of a sudden it does. Sorry, guys, that is the pandemic. And then it's only going to cause post-surgery recovery to have more excessive inflammation. And this can delay tissue regeneration. So it's going to slow down your repair, increase the pain and swelling, promote the formation of adhesions or more scar tissue. And I don't know if you've heard me talk about scar tissue. It's a place where parasites love to hide and accumulate. They love that scar tissue. And then it compromises the circulation, oxygen delivery to healing areas, triggers systemic inflammation that affects your joints, your brain, and your mood. So you might have had an ankle surgery, but now all of a sudden you got brain fog and depression. Different areas of the body, they're connected, right? Okay, so you want to support your body's natural resolution of inflammation without suppressing it entirely. So that's where that fine balance is. Then you've got the immune suppression and infection risk. So surgery temporarily suppresses the immune function. This is due both to the trauma itself and the effects of the anesthesia, the steroids, antibiotics, stress. Your innate immune system, the first line of defense, is impaired, while your adaptive immune system, including antibody production, may take days or weeks to rebound. So this opens the door for post-operative infections at the incision site, respiratory infections, especially after that general anesthesia, delayed wound healing, and reactivation of dormant infection, Epstein-Barr, the herpes virus, varicella, shingles, candida overgrowth. I did a hot topic on candida auris going rampant in the hospitals. So you go in for surgery and you get candida. Now, candida is in our body. Everyone's got it. Everyone's got parasites. Everyone's got viruses. Everyone's got bacteria, but they play nice in that sandbox with the good bacteria and the good guys. But these situations, when our immune system is suppressed, when antibiotics kill off the good guys, when inflammation is up, leaky gut is up, these bad guys start taking over, candida especially, fungus, and then the candida protects the viruses, and the viruses play with the parasites. They all play together, they all reinforce each other, and then you can get a really bad infection that even the medical system doesn't have drugs that can work anymore. A lot of these drugs have become, or these pathogens have become resistant to the current medication. And that's what they're finding with the Candida auris in the hospitals. So the hospitals, like I was just talking about, it's one of the most pathogenic dense environments. You go to a hospital thinking you're going to be protected and everything's clean, and that could not be further from the truth. Even with the excellent sterilization protocols, the exposure to resistant bacteria, candida, fungus, viruses is higher than in everyday life, and your body needs immediate, sustained immune support to prevent these complications and restore the defense systems. And remember, your immune system's down, right? So it's a double whammy. Then you've got the microbial imbalance and the gut disruption. So most people are prescribed antibiotics during or after surgery. And while most of them can be life-saving, they also disrupt the gut. They wipe out the beneficial bacteria, allowing for the opportunistic organisms like candida to take over. And that can lead to bloating, constipation, colitis, diarrhea, increased intestinal permeability, meaning leaky gut, meaning that the food particles that are not assimilated or broken down the way they're supposed to get through the intestinal wall lining into the bloodstream. The body says, oh my gosh, I don't recognize what this is. Let's have a huge autoimmune response. Then you've got food sensitivities, higher histamine reactions, weakened immunity and inflammation. Then that leads to the mood swings, irritability, and post-op anxiety. How many of you had surgery or even just a round of antibiotics and go, why am I so anxious? Nothing's changed in my life. I'm just anxious. Well, that is connected to your gut, right? So the gut produces up to 90% of serotonin and plays a central role in immune function. Neglecting the microbiome can delay the recovery. And rebuilding that resilient gut is essential. So you've got to address your gut health. Then you've got the mitochondrial suppression. We are only as healthy as our mitochondria. Every cell in your body relies on mitochondria to produce energy, that ATP. That is your true cellular energy. But surgery suppresses mitochondrial function by causing the oxidative stress from the tissue trauma and medications, increasing the inflammation that blocks mitochondrial signaling so they're not talking to each other, and then depletes your nutrients, especially magnesium, B vitamins, CoQ10, and then the anesthesia and sedatives impair oxygen utilization. So your body's not using that oxygen the way it's supposed to. What happens then? Fatigue, brain fog, slow tissue regeneration. So if the mitochondria is not working, even if it's minor surgery, it can feel like it can take a massive toll on your system. You've got that emotional and nervous system issue. So if you're even mentally prepared, surgery often triggers unconscious fear, trauma, energetic imprints, especially if you've had negative experiences with hospitals or medical environments in the past. This will give you more of a feeling of loss of control, bodily invasion or touched under anesthesia, separation from familiar people or environments. You're alone, right? Post traumas that are re-triggered during these procedures. These can lead to post-operative anxiety, insomnia, nightmares, dissociation, emotional numbness. Many people feel not quite themselves for weeks after surgery or even longer. And their nervous systems just aren't, they're in this fight or flight and they can't come down. So what do we do, right? We need the surgery. We can't get out of it. You've got to be proactive. You want to address detoxification, your immune system, your inflammation, your mitochondria, tissue regeneration, the nervous system care to calm and help you with your emotional health, and microbiome. Lots of things. I know it's not just one pill. So the sooner you do it and the way you prepare yourself for it before the surgery is key. Okay. This isn't just about bouncing back. It's about emerging from the surgery even better and stronger than when you went in. So phase number 1, your immune system, infection prevention, and microbiome. The number 1 supplement I cannot mention here. You're going to have to DM me, comment, or look to the website for that one supplement. But guess what? That one supplement you can use orally and topically. I will go through the benefits of it, but to name it, you've got to go to the website. The number 2 one is the Megaspore Biotic to help with your gut microbiome. So we are worried about infection, right? So after being exposed to the hospital, your immune system is suppressed. We need to strengthen our immune system and our microbiome. And that is where supplement number 1 will support your immune system, prevent the infection, reduce that microbial load without hurting your microbiome. That is key. It is enhanced with scalar frequencies, and it helps devitalize foreign pathogens, the bacteria, the fungus, the candida, the viruses, all of that. You can use it topically, spray, or apply with a clean cotton pad, and you're sitting there going, what is she talking about? Like I said, guys, I can't mention it on this podcast. You're going to have to go to the website or DM me. You can spray it on the surgical site. It won't hurt it. You can use it on the incisions. You can it helps with the red and the swollen or inflamed tissue, the post-operative abrasions or irritated skin. I have to tell you, so I was in a car accident in 2015 and I was rear-ended at 50 miles an hour and my eye hit the steering wheel. I had 4 layers of stitches. It went down to the bone and I got all stitched up in the hospital. Back then, I didn't have access to a lot of the supplements that we're talking about. And the doctor gave me a topical antibiotic. And I said, I'm not using it. I didn't tell him that. And I used this supplement topically. I also used a collagen topically. And when I went back to the doctor, he's like, oh my gosh, this scar is healing so beautifully. And I actually was pretty shocked myself. I don't even think about the fact that I have a scar there because I can't even see it. And as women, we pick apart our faces, especially every day when we stare in the mirror, and I don't see it because it recovered so well. So you can also soak some sterile gauze in this solution, apply it over the area. And you can also, in addition to that, another option topically is to use the acceleridine iodine, which we'll talk about in a minute, with the accelerated scalar castor oil together as that mixture, topically on the closed wound. So not when it's open, on the closed wound to heal up the wound healing speed. And it will actually speed up that healing. Now, if it's open, you don't want to use the castor oil, but you can use the acceleridine iodine in the wound to increase that apoptosis, the turnover of the cells to improve that cellular healing. And then next, like I mentioned, the microbiome labs, the Megaspore. So this is a spore biotic. This is not a typical probiotic that can give you too much of a good thing or too much of the wrong thing. This one rebuilds your gut diversity after that antibiotic use, supports the immune modulation, reduces gut inflammation, helps you more resilient, helps heal that leaky gut. It helps prevent the candida or pathogenic bacterial overgrowth. It will give my gut something different than your gut because we need different things. And the spore biotic has a brain and knows what to give you versus me. So that is phase 1, right? Okay, phase 2, we need to detox and improve that cellular activation. And that's with accelerated iodine and accelerated nuke no more. So these two supplements, I am taking extra doses because of the local anesthesia. I'm not even talking about the full body and the x-rays that I had to go through. So I took it before and I took them after. And why? So the body is inundated with the chemical residues and the radiation, the anesthesia, the pain meds, the antiseptics, the IV dyes. These toxins create oxidative stress, burden the liver, slow recovery. These help with improving that cellular level detox. Now, what's so great is that cell membrane. Accelerated iodine is amazing for your thyroid health and your metabolism and fat burning and brain health and mood and all the things. But one of the most important things it does is it supports that cell membrane. And that brain is made up of iodine and fat, iodolipid value. So with that iodine, and then I take the phosphatidylcholine that is also at Accelerated Health Products. That combination supports my cell membrane to get the toxins out and nutrients in. And I honestly feel amazing, even though my body went through this little dip in trauma. So I believe it's that combination that is saying, oh, well, we're fine. We can get all those toxins out as soon as they come in. And then the Nuke No More is also supporting that. But the accelerated iodine increases that ATP. So your cells have the energy to do the work, improve the immune system, supports that thyroid and metabolic function. Your thyroid is the master endocrine gland. It's supporting your adrenals, your gonads, and everything. Supports your brain. Supports your immune system. Iodine is known to be antiviral, antibacterial, antifungal, anti. It is amazing for all of those things. It has been used on wounds. I mean, surgical procedures use iodine at the source of the incision or on animals. Iodine is used all the time. So you have to think back to, okay, well, why don't I just use that versus an antibiotic? That's in a whole nother story. I'm just assuming that the doctor is putting you on an antibiotic. It supports, flushes out the halogens, the fluoride, chlorine, bromine. It is so powerful as an anti-inflammatory and reducing oxidative stress. Like I said, you can use it topically, use a clean Q-tip just to apply the incision sites or the joints or areas of inflammation. You can also combine it with the castor oil and use a castor oil pack. So over your liver to help your liver flush out those toxins and open up those detox pathways, but then over the actual wound area, remember, only use the castor oil once the wound is closed. And you can put that pack over there to reduce inflammation and speed up the healing. And you can also put it over your thyroid or your lower abdominal area if you're having PMS symptoms and you need to reduce your cramps or you want to improve your thyroid health. You can put it over your thyroid. Those are just bonus. And the Nuke No More is for the radiation and the anesthetic residue. So the purpose is to gently remove the energetic and chemical imprints of anesthesia, EMFs, radiation, surgical trauma. So it will help work with the accelerated iodine. Okay, phase number 3, tissue repair, inflammation, scar support. That's where the accelerated scalar castor oil comes in, like I mentioned, and using the accelerated, you're using that to help with the scar tissue and the wound healing, and then accelerated aminos. Did you know that me at the age of 49 needs more protein, almost double, than my daughters who work out 4 hours a day for rowing? Because as we get older, our bodies don't assimilate protein as well, and we need more. So this is where the accelerated aminos come in, because I know you don't have an easy time getting in all of the protein you need. And when you go through surgery, your body needs even more protein and building blocks to recover. So first, with the accelerated scalar castor oil, it will dissolve the scar tissue adhesions, calm the inflamed fascia, support the lymphatic drainage, nourish that connective tissue, put it directly over the closed incision or scar, over the liver to support your detox, and use it with the accelerated iodine along your spine or joints for any inflammation or nerve support. That's what you do. And I love doing it every day. It feels great. Also helps with bloat. If you just want to put it over your stomach and you're really bloated, you will wake up and have a flat stomach. I promise you, it works. Combining it with the accelerated iodine as well. Your skin holds 20% of your iodine stores. Now, the accelerated aminos is not just an amino supplement. I designed this for us women who have a hard time getting in our protein, and we need muscle mass for longevity. That muscle mass is also going to support you during surgery, because you probably are going to lose muscle mass with recovery. So you want to make sure you are supporting your body with enough protein. And the amino acids, one dose is the equivalent of 30 grams of protein. If you're 150 pounds, you need 150 grams of protein a day. So one serving can account for 30 grams. You can take 2 or 3 doses a day. It's great. Before, after a workout, before bed, it helps increase growth hormone, tissue repair, gut repair. The cofactor ingredients in accelerated aminos is unlike any other amino acid supplement out there. Helps with that increase of ATP, helps with the gut repair, the increased assimilation of not just the amino acids by 40%, increase over any other amino acid supplement, but actually increase the assimilation of all of your dietary intake. So super important for all of those nutrients that you're taking in to support your recovery. And surgery depletes that protein stores very quickly. It fuels that collagen and muscle repair, helps with preventing the muscle wasting that comes from being in a bed, right? Increases that ATP, and that ATP is really important for quicker healing, supports the immune cell regeneration, also helps with mental clarity and stamina. And so I told you that I designed this for us women over 40. But it's great for the women athletes in college. It's great for the bodybuilder men in their 20s. It's great for the 71-year-old man who is in the gym trying to fight that age and build that muscle. It is amazing for everyone, and the benefits go across all genders, all ages. And I'm loving it because it's also helping with fat loss and muscle building at the same time. You can increase your muscle while burning fat. It is possible with the accelerated aminos, but super important during surgery recovery. Phase 4, organ recovery and inflammation. So you've got the accelerated liver care and the accelerated cellular detox powder. This, I cannot stress enough. Your liver is everything. It is being asked to do so much. It's where we process and assimilate our protein and our fats and our carbs. It's where we open up the detox pathways and help get rid of the radiation and all of the toxins that we don't even know we're being exposed to. And then you throw on all of this other stuff from that surgery. Your liver needs a helping hand. And the accelerated liver care is comprised of 13 rare herbs that work synergistically together. It is more powerful than any other liver supplement I've ever seen. And I've seen it work with me. I am doing high doses of it through what I've gone through, and my liver feels amazing. It helps with the bile flow for getting rid of the toxins. It repairs your liver cells damaged by the pharmaceuticals. It helps with the T4 to T3 thyroid hormone conversion, reduces liver-driven inflammation and congestion, helps with your immune system, improves nutrient absorption, and so many other things. Of course, it's enhanced with scalar frequencies to open up the liver and the gallbladder meridians so those herbs know where to go and what to do. No other liver supplement does that. And then what is so important, and I have been taking spoonful by spoonful of this, is the accelerated cellular detox powder. It is the cleanup crew. So once the toxins are mobilized, this sops everything up, takes it out of your body gently. Guess what else it can do? For the local anesthesia, right when I came home from the dentist, I put it in my mouth just to soak up from the tissue the detox powder to soak the toxins into my mouth, so it was just gone and quickly absorbed, quickly taken out of my body. And then I would do the liver care, and then an hour later cellular detox powder, and would take upwards of 2 to 3 tablespoons at a time, just to make sure I'm getting it all out. It binds and removes the heavy metals, the anesthesia residue, glyphosate, mycotoxins, helps with bloating, brain fog, fatigue. It soothes the gut lining with the slippery elm and the triphala. It helps with your bowel regularity. How many of you were really constipated after surgery? So this helps with the bowel regularity. Now, if this isn't enough, you can always use like something like the Oxy powder or Laxa Comfort or magnesium to help with constipation. The next phase is skin and lymph. So you can use the accelerated ancient salt. Salt helps plump up the blood to get the toxins out quicker, right? So put it on your food. Use it about 10 to 12 minutes after the accelerating iodine and Nuke No More regimen. You can also put it in a detox bath. Just put a couple tablespoons in the bath and then fill the bath with a cup of just some Dead Sea salt from anywhere else to save on cost. You can use dry brushing, but the skin is a massive detox organ. So you want to use it to get rid of the all of the toxins. It will help take the burden off the liver and the kidneys. And then you want to, of course, support this with a full organic, clean, wild protein diet with vegetables and fruits on the accelerated food guide. Use a rebounder to help your lymph. You can use lymphatic drainage methods. You can use red light. You can use, here it is, the Hiwi. The Hiwi has detox programs from pharmaceuticals, from anesthesia, wound repair, surgery repair, thyroid health. Maybe you got a virus in the hospital. I bet you it has that virus on here. Over 60,000 different programs. Maybe you lost some hair from the stress of it. It's got hair growing programs. This device is on me almost all the time because it is so powerful. It is the cherry on top. First is the diet and the sleep and the movement. Then is the supplements. And this is the cherry on top. So the Hiwi is also on acceleratedhealthproducts.com. So you can use these tools. You will feel so much better. You will recover like a champ and feel better than ever. And I hope this was helpful. This was inspired by a lot of surgeries in my family this year, and I thought it was needed. So thanks for listening. Our discussion does not have to stop here. If you're feeling lost, I'm here to help. You can start by getting your free supplement protocol. Head to SaraBantaHealth.com. Complete the form, and I will personally put together a protocol for you. Follow me on social media at Accelerated Health Products and join the free group coaching on Telegram. I answer your questions, post insights, keep you moving forward. The link is at SaraBantaHealth.com. You can find this podcast and all of my podcasts at Accelerated Health with Sara Banta on Spotify, Apple, YouTube, E360, Amazon, iHeartRadio, and over 100 different platforms. Share this episode with your friends that just went through surgery or have one coming up. They need this information. And you can use coupon podcast10 to get 10% off site-wide. Remember, I'm live every Monday, Wednesday, and Friday. So join me next time for more ways to unlock your health potential.